We're now going to move to hear from Kaltum and Finlay, two of our Look mentors who themselves have progressive sightless conditions. So, for anyone who doesn't know, our mentoring program is a free service for visually impaired young people that I think Bhavna mentioned before, where we connect VI young people with an older mentor who often might have the same eye condition or has kind of relevant life experience to that young person, so that they can be connected and in touch with each other through a secure platform for about 12 months. And our mentoring service is really all about that kind of that connection, bringing people together, giving young people another resource to tap into, another person to chat to, who can relate to their experiences and who can provide that kind of lived experience knowledge. So thank you so much to Finlay and Kelton for joining us tonight to share your experiences with us. So I'm going to ask you to start off by telling us a little bit about your diagnosis, if that's okay. So if you can tell us a bit about what age you were, how your diagnosis unfolded, and what those early conversations were like for you and your families. Finlay, shall I come to you first?
Yeah, that's okay. Um, well, hello everyone. Um, like Ellen was saying, um, I'm mental for look, and I have Lehon, so Leber's hereditary optic neuropathy. Um, it started when I was 15, however, it is in my family quite strongly and passed through the maternal side. So around the time my sight began deteriorating, and similarly we thought maybe I just need glasses and things, but it just kept progressing kind of like that for a couple of months, until we saw a local specialist because it was becoming quite a worry with what it was like in the family. And, strangely, this local specialist said 99.9% chance this is not Leon. But my family really didn't want to take that answer because of the threat of how fast it can progress. And so we
Mm,
ended up being referred to the RVI, where we saw Dr. UY Mann. And after a week of very intense testing, he did deem himself that it was Lejon and provided some various options, including more of a drug therapy and a clinical trial, which I ended up taking part in a clinical trial.
thank you, Finlay. How old were you when you were diagnosed?
15.
15. Okay, thank you. And Colton, what about you? How old were you and what was that like for you?
Hi, my name is Kaltum. I got diagnosed with Stargardt's when I was 13 years old. It was around February 2017, I think.
Mhm.
My family had a history of Stargardt's, like a lot of my older siblings have it. So when I was around year six or around 11, I had to move to the front of the class. And my dad took me to the like opticians, and they gave me glasses. And then I went
Mhm.
to opticians the second time, and they told me like, oh, potentially, you could also have Stargardt's. But because my siblings had it, I was already very much, um, I already had it in my brain that this is probably what's happening. And then yeah,
Mm.
when I was in year eight, I went to the Manchester Eye Hospital, and yeah, I got diagnosed like official diagnosis.
Okay, thank you. Thank you both for talking us through that initial step. So I know when we were sort of having our preparatory discussions for this event, one thing that we talked about for a long time and that was really important to both of you to kind of bring up was around this idea of guilt, because we know that parents can often carry a huge weight of guilt around inherited sight loss. So would you be okay to tell us a little bit about how your family's navigated that, and what would you want the parents listening tonight to know about how that feels for you, from the perspective of the child and that situation? Carlton, do you want to go first this time?
Um, my parents, I think naturally all parents, when their child is diagnosed with something, especially when it's inherited, might feel this inherent guilt, especially if they carry the gene. And it's pretty evident when they feel that way because as a child you're very observant and you know your parents pretty well. With my parents in particular, because I had so many siblings older than me, I think by the time the eye condition reached me, they might have already like come to terms with it themselves. So I was
Mhm.
pretty lucky. I got like the better end of the stick. However, I can understand other parents who might have a child who's got recently diagnosed or might not have experience with eye conditions in their family. But I feel like one advice that I would really emphasize with parents is that you shouldn't feel guilty. Naturally, the course of life has all these unexpected things happen, and that as much as your child is coming to terms with their eye condition, you are also grappling with your child having an eye condition. So I think as much as your child is going to go through a journey of learning how to cope with their eye condition and learning how to adapt, if your child's really young, I feel like you're also naturally gonna go through that all same thing. So I think parents should give themselves a lot of grace, and just be as empathetic with themselves as they are with their children.
Thank you so much, Kaltum. That's such a lovely message. What about you, Finlay?
Yeah, I think guilt was present in my family, especially because it comes through the maternal side. I think
Mm,
my mum felt that quite strongly, because all of her brothers were affected as well, and so she kind of saw that process from a young age, and then seeing it happen with me, I think
hmm
it was quite intense for my parents, and I think from my perspective, it shouldn't. Sorry, it's nothing to not to invalidate the feeling, but to me, it shouldn't be something that she's guilty for because obviously it would never be the parent's choice to put that on their child.
mm,
And I think, in my perspective, I've never blamed my parents. To me, it is what it is, and they've done everything they can to try and help, support, and change that when we were part of the clinical trials. So really, I have no negative feelings, only like respect and happiness and like gratitude because of that. I'll
Thank
turn
you
this
so
off.
much, Finlay. Yeah, no, thank you. I know that when we were talking about this we were preparing for the session, we all kind of had this moment of thinking like, have you ever blamed your parents for it? And we were all just a bit like, just no, it's never popped into my head. And I think you both agreed that like it's never a thought that's occurred to you.
Yeah.
So hopefully that's some comfort to people who are struggling with feelings of guilt. That it's never been a thing that's occurred to me.
No.
And I think you'd both say the same.
Yeah, absolutely.
Yeah, cool. Thank you. Um, you've both mentioned as well that how parents talk about our eye conditions and can really help shape how a child experiences that situation. So, are you able to tell us a little bit about how or what helped and what didn't help in how your parents framed things growing up? So, anything that was helpful and anything that was maybe less helpful? Finley,
Um,
yeah, there you go.
yeah, sure.
Thank you.
I I think I mean, we all know that to be diagnosed with something progressive is very scary.
Mm,
Um, and I think it's easy to think at the time, like, what is this going to be like in a couple of years? How is this going to affect me when I'm trying to get a job? All things like this. And something that really helped me with my parents is they really emphasized like this idea of one step at a time, kind of like what Bhavna was talking about, just to get the next exit on the motorway. It's
mm,
just kind of like adapting to what your current situation is. And like just yeah, we'll cross that bridge when it comes to it kind of mentality really helped me to take things a lot slower and like almost less more grounded than what I was originally thinking because it is easy to have these larger thoughts than really what is happening right now.
yeah.
Um, in terms of what I didn't find helpful, I mean, of course, at the beginning there's a lot of trial and error, but I think with my family's experience and with the lay home being quite present in it, I think there was already kind of an idea of how to help, and my mum was like especially immediately good with knowing what to do. So I don't think in my situation there's really anything negative or anything.
Mm. Thank you. What about you, Kaltum? I know we spoke a little bit about, when parents might feel they need to try and hide how they're feeling from their kids, which is completely understandable. Are you able to talk a bit on that?
Yeah, I think I will. I think the way that children react to their the way parents react to their child's visual impairments day to day is more telling to their kid than anything else. And I think if parents are like afraid of their kid going out or doing stuff that are pretty like a normal person does all the time, or like not giving them the independence to like cook their own food, or just like not giving them the independence to try, it kind of puts people with disabilities in this position where they're infantilized, and it makes them grow up to like think that they can't be independent, and kind of like makes it so that they make their own obstacles. So like if you think like right now, a parent might be telling their child they can't do something, but when their child grows up, that child might tell themselves that they're not being able to do stuff without them even trying. So I think one thing we agreed on last time when we were talking was that, as you were saying, like it's try, like give yourself the opportunity, the child the opportunity to try stuff, even if they're going to fail, and even if you know it's going to be harder for them to do it, just giving them the option to try and like be as independent as they possibly can, even if they're younger. Because when they grow up and when they leave the house one day or want to just like be on their own, you don't want the like the negative voice in their head to be their parents' voice, if that makes sense.
Yeah, it does make sense. Thank you, Kaltum. Thank you for sharing with us that. So thinking about, so Finlay, you've mentioned already that you took part in a clinical trial, and I know, Kaltum, that you've said previously that you decided not to take part in research. So can you both tell us a little bit about what led you to those choices and how your families navigated those decisions that you made? So maybe we'll start with Finlay.
Sure. Um, like I say, when I was diagnosed, it was a case of being immediately presented with options like, and it was almost framed in a way as like, if this isn't caught now, it's gonna get significantly worse. And
Mm,
of course, like, I think even now I would try anything,
yeah.
um, to try and come to maybe a better sight level. But um, yeah, my family took part in local research like in the previous generations as well, and I
Mm,
think just hearing the chance that like I would be monitored by the people who like caught it in time as well was kind of comforting in a way. And then yeah, just
yeah.
having this hope for like a pioneer in gene therapy just sounded like it would help as well. So I thought, we found comfort in the hope that it would give.
Thank you. And what was that experience of the clinical trial like for you? I know when we spoke about it, you said it was quite long and a lot of really long appointments and stuff, wasn't it? And quite a lot of travel and quite tiring.
Yeah. Yeah, so um going from around Newcastle to London, it was this particular trial was only taking place, I believe, in Germany, America, and London. So
Mm,
we had to travel quite far each time, and the days were quite long with like quite grueling tests each time. And it was framed with this idea: the younger, the better for the treatment. And apparently, I was the youngest one who had it because right as I was diagnosed, they actually moved the age just to 15, like the month
mm,
before.
wow.
Um, so like to my family, it almost seemed like a stars align moment. Like the younger, the better.
Mm,
They've just moved it. Um, and they said like this treatment will take place over like it will take its course over a year. In a year's time, it could be better. And I was hearing stories about people who had it up in Scotland, like in the previous year's trial, who apparently had like their sight fully restored. So I had a lot of hope at the time. And of
yeah.
course, when the year goes by, and obviously in the end, I don't truly know how much it like had an impact. I
Mm,
could be like totally blind without it. I don't know.
yeah.
Um, so I'm thankful for what it potentially did, but with the hope that was being given, it was almost like a recipe for disappointment.
Mm,
Um, and eventually I took part in like the extended trial and things, and like with doctors being changed around it, it started to seem less like an individual case and more just like numbers on a spreadsheet kind of.
mm,
Um, so it was a little bit frustrating, but I did the extended one because you would hope that like continuing to help with research would lead to more things and opportunities for maybe others and things in the future. But I think in the individual case, there was a little bit of frustration, but of course I can appreciate maybe what impact it did have, even if it wasn't as much as we initially hoped.
yeah. And so was it a case of you and your family all like deciding together, how to kind of navigate? whether to start that clinical trial, whether to do it, and then as time went on, what your next steps might be. With I imagine your family were always with you in all these different appointments and
Yeah.
tricky
Yeah.
conversations.
Yeah, I think we immediately had like the idea that of course we're going to try something, we're not just going to leave it.
Mm,
Um, and the clinical trial out of the options just seemed like the best one. Um, my family like had that idea from the get-go,
mhm,
and so I just like agreed because like you would do anything in that situation, I feel like.
mm,
Or maybe a lot of people would. I can't speak for everyone, obviously. And yeah, so they were there every step of the way, honestly, like deciding to do the extended one and then like talking to the doctors at the end about maybe what we could do next or things like that. Like my
mm.
family was always just so part of it. Every time I traveled, both my parents would go and my sister would constantly be messaging, so it just felt like it was really supported by everyone at the time.
Thank you. So yeah, you meant, not everyone will have the same experience, and I'll come to you, Kaltum, because you've decided not to kind of be involved in research and things like that. Can you tell us a bit about your point of view?
Yeah, I got the day I got diagnosed at the end of the appointment, they gave me this really big booklet, huge, and they were like, in London, there's a research happening about children with progressive sight loss or just like visual impairments and like the emotional aspects of it, like how you feel about being diagnosed and stuff. So when I got it, I was pretty like I didn't really care about it because I just got diagnosed with eye condition. So I really wasn't thinking about filling out a booklet. But my mom did say to me, oh, maybe you should fill it out. And if you feel like it, just send it off. But I didn't end up doing that.
Mm,
Looking back, I just felt like it wasn't an appropriate time. And I feel like, it felt looking back now, it feels like I didn't, like the way I would have answered it, it would have been very like just someone who just got diagnosed with an eye condition. Like I didn't think it was an appropriate thing to just give me as soon as I got diagnosed with the eye condition. And yeah, I just feel like did it make me like on going on from that, did it give me like a bit of a hesitancy when it came to research and stuff like that? Potentially. But yeah, it was just something that I didn't feel comfortable doing at that time. And I felt like it was very misplaced. And maybe if I was diagnosed for longer, and maybe if like QTVI gave it to me that I met before and like had built rapport with or like had a relationship with, maybe I would have, or maybe if someone helped me fill it out. Like there's a lot of things
mm.
that I wish happened, but none of that happened, and I was just handed like a very thick booklet asking me about my emotions the day that I got lost.
Quite intense.
Mhm.
Yeah. So yeah, I mean, both of your experiences are, so valid and different, but both so valid. And I know that what we talked a little about before as well was how, your parents always kind of involve you in all these decisions, and are kind of guided by what you want. And I know that was something that felt was important to communicate when we chatted previously, was that parents to help you in those decisions, and how it's quite a fine line to walk, understandably, of like deciding whether or not to take part in these things. And but the main point being that everyone's situation is different, and there is no right or wrong answer, really. It's really down to your individual circumstance. And like we said before, you're an ophthalmologist and your consultants are the best people to advise on your specific situation. Um but yeah, it sounds like both of your families were quite involved and supportive of your decisions in those moments. Um, I know we touched on this earlier as well, and this is something that's come up from people registering as well to attend tonight. Is when we live with progressive sight loss conditions, it means that we live with quite a lot of uncertainty. And I know, Finn, you've touched on this already. So I wanted to ask you both, how much do you think about the future, and what's helped you manage that uncertainty over time? I know that, we've touched on that kind of step by step process already, and that kind of approach to things. I guess I'm especially thinking about times when you're navigating big changes, or like big moments in education, or changes, big moments when your sight level has really changed. Is there anything that's really helped you navigate those kind of changes? And how much do you think about the future? Colton?
Okay. Um, I think I do think about the future a lot. And I do acknowledge that, like, I've come to terms with the fact that my future, like, there are moments that I might have to pivot my plans for the future, especially because now I'm 21 and I'm graduating university. Like, I have a sort of plan of how I want, like, the next few years of my life to look like. But naturally, because my eye condition is progressive, there might be moments that I have to pivot and change stuff.
Mm.
So I do think about it quite often, and I feel like moments where it might get me like a bit down just because of all the uncertainty. I think what Finley said is something that I like to say to myself a lot. It's like, just small wins all the time. Like, just try to do small steps. And I also try to think back to the past, like, oh, like when I was 15 and I was stressed, I still managed to like do my GCSEs. And when I was 17 and I was stressed, I still managed to do my A-level. So I feel
Hmm.
like that's something that I like to do a lot. Like I like to journal down how I'm feeling and just like look back on it like a year from now, this is how I felt and look how far I've come. So I think what Finley said is a really great way, like taking it one step at a time and like being able to pivot. And yeah, I think that's something that I think is really important.
I like that phrase pivot. It comes back to what Bhavna was saying before as well, isn't it? It's kind of taking a different exit. We're always coming back to this idea of you don't have to stop. You just do it a bit different or take a slightly different route. Thank you. Finn, is there anything else you want to add on that topic?
Um, yeah, I think a bit similarly. Um, my sight began to deteriorate during my GCSEs. Um, and I had a lot of people around me at the time, including like school staff, the really brilliant local VI service.
Mm.
And so I was like, I think I learned how to adapt things. I learned what worked quite quickly because of those people around and like their support and like trying different things. And so um, I think I found comfort in knowing that I could adapt to these situations or and then like taking the step towards university, like more self-advocacy. And so I
Hmm.
think like having that skill now and like knowing I've been able to adapt in the past and how it works is quite comforting to know that if it gets worse or I have to make a little bit of a different move in the future, like I think I would be able to. Um, and yeah,
Brilliant.
just
Thank you.
yeah, I was just gonna mention like about like thinking of the future in terms of like if it might deteriorate. I do think
Mm.
of that, and I would just mention because um, especially around the time of the year where I was diagnosed, I think it's easy to think about as well, like what the future might hold with it.
Yeah, we
But
mentioned that, didn't we? That like certain times of year might kind of trigger you feeling a certain way because you remember,
mm,
especially if something kind of big happened at a certain time of year, you might that those specific periods might be harder than others.
mm, um, yeah, I think like especially like when around the time where I would have had the treatment in
Mm.
2017, I do think of
Mm.
that like this is like in 2018, I thought like this is the time where it should have been so much better, and then every year since I'm like, oh, this is this is that time of year again.
Mm.
But yeah, I think it's easy to think of those things, but then of course like coming back from it, you have to think about the things that have went right as well.
Yeah, and I think the important thing that you both have kind of touched on there is that it's not far from your mind, but it doesn't necessarily stop you doing anything either.
Mm,
It's like we said at the beginning, it's the elephant in the room, but there's no point not addressing it, is there? It's kind of better
yeah,
to talk about it than not to,
yeah.
if that's kind of appropriate for you. So, um, and just to use Coltum's word from earlier, just to kind of pivot a little bit here, I know that this is something we wanted to touch on as well when we were preparing, and I am conscious of the time, so we'll go to Kate really soon. But I just wanted to finish up and ask you both, when we were chatting, in preparation for the session, we talked about how you know a sense of humor and like blind jokes are actually quite helpful as like a coping strategy, and part of how you cope and kind of deal with your situation. So could you tell the group a little bit about how your families respond to blind jokes, and what would you say to any parent who's like not quite sure how to respond to that?
Sure, yeah. I think in my case, I just it is like a coping mechanism. So
Mm,
obviously I did start to make blind jokes, um, especially around the time when it first started. Some members of my family, like my dad, just really didn't find it funny whatsoever, or just didn't want to find it funny. And I think
mm,
maybe that's because feels bad about what's happening. But I think it's okay to know that it's fine to laugh with the person making the joke, because at the end of the day they're using it to, in a way, like accept or come to terms or again cope with the situation. So I think it's fine to laugh
yeah,
but obviously everyone knows their family.
yeah, definitely. Thank you, Finn. Kaltum, anything to add to that?
Yeah, just what he said. It's okay to laugh. It's actually worse to not laugh. Because imagine someone makes a joke and you don't laugh. Like, I'd rather you just laugh at the joke. But I think my siblings also have the same eye condition, so I laugh. We make the same jokes and we laugh at it. And our parents just have to laugh. Like, it would be worse to be the only one who isn't laughing.
Mm. Yeah, thank you guys. I know there's more that we could say as well, but we'll come to Kate and then we'll probably come back um to more questions later. So thank you both so much for sharing with us just now.